Panniculitis is an inflammation of the layer of fat just under the skin. It can be divided into two main patterns. Septal, the inflammation stays in the walls that separate fat lobules, and lobular, the inflammation spreads inside the fat lobules themselves. Think of a block of cheese. The septa are the thin lines that divide the cheese into cubes. In septal panniculitis, the cheese cracks along the lines, while in lobular panniculitis, the whole cubes become soft and swollen. Many things can trigger panniculitis. Common causes include skin infections, cold exposure like frostbite, certain medicines such as calcium channel blockers, autoimmune diseases like lupus, and fat-related disorders like pancreatic disease. Septal panniculitis often follows a bacterial infection or a cold injury, while lobular panniculitis is frequently linked to systemic illnesses such as pancreatitis or connective tissue disease. People with panniculitis usually notice tender, red, or purple lumps under the skin that can be firm or soft. The lumps may be painful when you press them, similar to a bruise that doesn't fade. Septal forms often have clearer borders and may show nodules that feel like small buttons. Lobular forms can feel more diffuse, like a swollen area of dough. Fever, weight loss, or joint aches can appear if an underlying disease is present. Doctors start with a physical exam and ask about recent infections, medicines, or illnesses. An ultrasound, or MRI, can show how deep the inflammation goes. A skin fat biopsy is the gold standard. A tiny piece of tissue is examined under a microscope to see if the inflammation is in the septa or lobules. Treatment depends on the type. For septal panniculitis caused by infection, antibiotics are used. For cold-induced cases, warming the area helps. Lobular panniculitis often needs treatment of the underlying disease. For example, pancreatic enzymes for pancreatitis, steroids, or immunosuppressants for autoimmune causes. Warm compresses, anti-inflammatory creams, and pain-relieving tablets are useful supportive measures. Because panniculitis is often a reaction to another problem, the best prevention is to control the trigger. Keep skin clean and treat infections early, avoid prolonged exposure to cold, and discuss medication side effects with your doctor. Maintaining good nutrition and managing chronic illnesses like diabetes or autoimmune disorders can also lower the risk of developing lobular panniculitis. Recent research is looking at the role of tiny proteins called cytokines that drive the inflammation in panniculitis. Small studies suggest that targeted biologic drugs, which block specific cytokines, may help patients with stubborn lobular panniculitis who do not respond to steroids. Additionally, high-resolution ultrasound is being used to differentiate septal from lobular patterns without needing a biopsy.